Let's consider you are driving on a highway which has got open and wide lanes. The flow of traffic will be smooth. What if the road narrows or more car fills the road? What will happen to the flow of traffic? It will slow down. And this is because the resistance will increase. The same concept also applies to our blood vessels. If the blood vessels narrow down or if the viscosity will increase, the flow of blood will slow down. It's because the resistance will increase. So today we are going to discuss three important factors that affect the systemic vascular resistance. You know that there are two important types of circulations in our body: systemic circulation and pulmonary circulation. Pulmonary circulation is low resistance circulation. Our main emphasis today will be on the systemic vascular resistance, which is also called as total peripheral resistance. So we'll study these three factors that affect systemic vascular resistance, what is their effect on blood flow and how do they affect the blood pressure. But before that, it's important to know that the formula of blood pressure according to Ohm's law is blood pressure is equal to cardiac output into resistance. So according to this formula, if any factor increases the resistance, this will increase blood pressure. So the first and most important factor that affects systemic vascular resistance is radius of blood vessels. Resistance of blood vessels is inversely proportional to fourth power of the radius or diameter of blood vessels. This is also called as Poiseuille's law or fourth power law. There are chemicals in our body which can dilate our vessels, and those chemicals they are called as vasodilators, like histamine, bradykinin, potassium, magnesium ion, carbon dioxide, hydrogen ions, and also nitric oxide. These vasodilators dilate our blood vessels, and because they dilate our blood vessels, they decrease the resistance. More will be the diameter, less will be the resistance, and because they decrease the resistance according to Ohm's law, the blood pressure will decrease. Now I will exactly tell you what will be the effect on vascular resistance by doubling the diameter of a vessel. Let's suppose we have got a blood vessel, the diameter or the radius of which is 1. What will happen to the resistance if its diameter doubles? So in case when its diameter doubles or radius doubles, according to fourth power law, the resistance will be inversely affected. So you can see here, if the radius is doubled, so 2 times 2 times 2 times 2, which means 16. So it means the resistance will be decreased by 16 times and the blood flow will be increased by 16 times, because blood flow and resistance, they are inversely proportional. What will happen if the radius or diameter of the same blood vessel becomes 4 times? So then in this case, 4 times 4 times 4 times 4, the resistance of the vessel will be decreased up to 256 times. So resistance is decreased up to this much times, and the flow of blood will be increased up to 256 times. So you can see here, by slight change in the diameter of a blood vessel, there can be tremendous change in resistance and tremendous change in blood flow. And keep in mind, the resistance and blood flow, they are inversely proportional to each other. So let's link it to a real life example. Let's suppose you are drinking milkshake from a glass, and you have option to use a narrow straw and a wider straw. So what do you think, which straw will help in sucking the milkshake at a faster speed? It will be the one with wider bore. The reason being because a wider straw will have more diameter and it will have less resistance. So that's why you can easily suck the milkshake. We can also link it to a clinical example. Those who have anaphylactic shock in response to penicillin injection, what happens to their resistance? Because in case of anaphylactic shock, there is release of histamine throughout the body, and this histamine is a vasodilator that dilates your vessels, and hence resistance will be tremendously decreased. And according to Ohm's law, when resistance is decreased, blood pressure will also be decreased. So this is why those who are having anaphylaxis going on in their body, they can have sudden drop of blood pressure. Here I will ask you a clinical question. We have got a kind of drugs which we call as nitrates. These are vasodilators and they act on the arterioles to dilate them. So what do you think what nitrates will do with the resistance of the arterioles, and what will be its effect on blood pressure, and why these nitrate drugs can be used for the treatment of hypertension? What will happen to the resistance of blood vessels if their diameter decreases? Let's suppose if the diameter of a blood vessel decreases to half or by 50%, what will happen to resistance? Then its resistance will increase up to 16 times and the blood will be decreased by 16 times. So sometimes you may get this kind of question in your examination. There are some chemicals in our body which can constrict our blood vessels, and these chemicals are called as vasoconstrictors. Some important vasoconstrictors in our body are epinephrine, norepinephrine, calcium ions, endothelins, and also ADH hormone or antidiuretic hormone, which is also called as vasopressin. Contrary to nitric oxide, which is produced from the healthy endothelium and that acts as a vasodilator, endothelin acts as a potent vasoconstrictor, and this is released from the damaged endothelium. So this is why those who are smokers and all those patients who are having damage to their endothelium, they produce more endothelins, and this is one of the reasons why these people have increased blood pressure, because this chemical constrict their arterioles and hence increases the resistance and increases blood pressure. Another important factor that affects vascular resistance is blood viscosity. When blood viscosity is higher, the resistance will be higher, and when blood viscosity will be low, the resistance will also be low. So it means that blood viscosity has got direct relationship with resistance. Blood viscosity is affected by two factors. One of them is red blood cells and the other one is plasma proteins. So any condition in which number of red blood cells or plasma protein concentration increases in our blood, that will increase our blood viscosity. In case of polycythemia, the number of red blood cell is high, so that will increase the blood viscosity, which means the blood will become thicker and hence the resistance will increase and the blood flow will decrease. This is analogous to the thickness of honey. You know that honey is thicker than water, so this is why honey can flow slowly as compared to water. What will happen in case of anemia? Because there are less number of red blood cells available, the blood viscosity will decrease and that will decrease resistance, and hence blood flow will become faster. So it means an anemic patient has got hyperdynamic circulation, but in case of polycythemic person, the blood flow will be sluggish. Can you answer in the comment section why polycythemic patients are more likely to have high blood pressure? The viscosity of blood is 4 times that of water, and this is mainly because of concentration of red blood cells. Now link it with hypertension and let me know why polycythemic patients, they are more likely to have high blood pressure. So third important factor that affects vascular resistance is the length of blood vessels. Shorter is the length of vessels, less will be the resistance, and greater is the length of vessels, greater will be the resistance. So it means the length of vessels is directly proportional to the resistance of blood vessels. This is analogous to the resistance which is offered by the cables to the flow of electricity. You may have studied in physics at your secondary school level that longer is the length of cables and wires, more resistance is offered by those cables to the flow of electricity. So we can relate this analogy with the human physiology. So length of blood vessels can increase in case of obesity, because in case of obesity our size of body, our weight, our fat mass is more, hence we have longer vessels. That's why when the length of vessel will be increased, resistance will increase, and hence the blood pressure will also be increased. So this is why those who are obese people, they are more likely to have increased resistance and hence increase blood pressure. This is just like if you have a water pipe system in your house, shorter is the length of the pipes, you need a smaller motor to pump water in those pipes. But if is longer is the length of those water pipes, you need a bigger water pump to push water in those pipes, because the longer pipes will offer more resistance. There is a good mnemonic to remember the three factors that affect vascular resistance, and this mnemonic is real life variables. R for radius of the blood vessels, L for length of the blood vessels, and V for blood viscosity. Viscosity of blood has direct relationship with resistance. Length of blood vessels also has direct relationship with resistance, and resistance is inversely proportional to fourth power of the radius. The most important factor out of all these three that affects vascular resistance is the radius of blood vessel. And mind it that two-thirds of all the systemic vascular resistance is present in arterioles. So by constricting the arterioles or by dilating them by various hormonal, chemical and nervous factors, we can tremendously affect the resistance of arterioles. By constricting the arterioles, we can increase their resistance and hence decrease the blood flow going to tissues. By dilating the arterioles, we can decrease the resistance, increase the blood flow going to the tissues. So I have a question for you. Answer it in the comment section. How blood viscosity is affected in high altitude climbers? Which out of these three factors that affect vascular resistance are changed in high altitude climbers, and how does it affect the systemic vascular resistance? So you will answer in the comment section. Now in the end, let's discuss a few MCQs. Which factor has the greatest influence on vascular resistance? And the options are blood vessel length, blood viscosity, blood vessel radius, and last one is blood volume. And the answer is blood vessel radius. Second multiple choice question is, what happens to vascular resistance when a person becomes severely anemic? And the options are, it increases, it decreases, it remains unchanged, and last one is, it first increases and then decreases. The answer is, in severe anemic person, the resistance decreases. B is the answer. And last question, why does obesity contribute to high blood pressure? And the options are increased cardiac output, B increased blood vessel length, C increased venous return, D decreased blood viscosity. So you will have to answer this last question in the comment section. I hope you like this video. If you find it useful, share it with your colleagues from various medical, dental, nursing and allied health sciences.